What is tuberculosis, and how is it transmitted? Imagine a disease that has been with humanity for thousands of years, quietly affecting millions of lives. That's tuberculosis, or TB, a bacterial infection caused by the bacterium Mycobacterium tuberculosis. It mainly targets the lungs but can also invade other parts of the body like the kidneys, spine, brain, lymph nodes, bones, and skin. TB exists in two main forms. One is latent tuberculosis infection, where the bacteria are present in the body but remain inactive. People with latent TB do not feel sick, show no symptoms, and cannot spread the bacteria to others. The other form is active tuberculosis disease, where the bacteria multiply, cause symptoms, and can be contagious. Most cases of TB are transmitted through the air. When someone with active TB in their lungs or throat coughs, sneezes, talks, or sings, they releases tiny droplets containing bacteria into the air. These airborne particles can linger in enclosed spaces for hours. If a person nearby breathes in these bacteria, they can become infected. It's important to note that TB transmission requires close and prolonged contact, such as living in the same household or working closely with someone who has active TB. Casual contact, like sharing dishes or touching surfaces, does not spread TB. Once inhaled, the bacteria can settle in the lungs and be contained by the immune system, forming structures called granulomas. This containment results in latent TB, where the person feels healthy and cannot infect others. However, if the immune system weakens over time, the bacteria can become active again, leading to active TB disease. Symptoms of active TB often include a persistent cough that may produce blood, chest pain, fatigue, weight loss, fever, and night sweats. Without treatment, active TB can be serious and even life-threatening. Fortunately, TB is curable with the right course of antibiotics, usually taken over several months. In summary, tuberculosis is a bacterial infection primarily spread through the air from people with active disease. It can stay dormant in the body without causing symptoms but can become active and contagious if the immune system weakens. Understanding how TB spreads helps us take effective precautions and seek timely medical care. If you suspect you might have TB or have been exposed, it's essential to consult a healthcare professional for proper testing and treatment.